First, I'd like to thank everyone here today for what I believe is one of, if not the most critical issue facing us today in this state and in this country. The one thing that is clear is that this bill will impact substantially state budgets all across this country. Once all the provisions of this legislation are completed, the impact is going to be devastating to the state budgets. And I feel that this legislation that passed in the House just last week, and the legislation that had gone through the Senate Finance Committee in Washington in Congress as well, same provisions, will very well lead New Hampshire down the road of a sales or income tax. And that's why it's so critical for state leaders, whatever party they are, to take action and speak out against this legislation that will have a corrosive impact on our New Hampshire advantage. Where I come from, they are called unfunded mandates. Not to mention the unintended consequences, but unfunded mandates, and we can't afford them, and we should not have them put into this legislation. Through this legislation, the federal government is using Medicaid as a primary tool to attempt to cover the uninsured without, and I stress, without asking their partners, the states, for permission. In fact, I call this kicking your partners down the curb. And New Hampshire needs to take action against this legislation. After reviewing the legislation and the analysis that I put together, and I believe you're going to see and hopefully agree that the New Hampshire budget will be impacted over the next 10 years at the tune of $1.23 billion. Keep in mind, and I'll stress, this is a very conservative estimate. I've looked at averages throughout, and I'll explain. In comparison, the National Conference of State Legislators also did an analysis, and they came up with even higher numbers than I'm going to give you today. So this conservative analysis expects to add to the state 61,000 new Medicaid enrollees. In comparison, again, the National Conference on State Legislators said the number in New Hampshire would be 83,000 new enrollees. And just to offer a quick look at each of the areas within the state budget that are going to be impacted, I put together a couple charts for you here, and I'll explain them in a minute. And all of you will be able to look at them. First, let's just look at this second chart here. Starting in July of next year, that will be fiscal federal year 2011. There are two provisions in the bill that mandate that the states start working overtime to sign people up on Medicaid that are currently eligible but have decided not to be on Medicaid benefits. These provisions force the state to develop an outreach program to identify the unenrolled in Medicaid and require them to sign up. So they show up in a hospital or community health center. We're going to have systems in place that require these individuals to be enrolled. In fact, the bill says the Secretary shall establish rules so that states shall, the word shall, sign these individuals up. There are two important factors to keep in mind about these provisions. First, there's no additional federal funding for these new enrollees. This is simply new Medicaid recipients that would come onto the roll. And second, there's going to be significant implementation costs, IT and startup costs, just to connect between, and I know as Commissioner, there's no connection between the 24 hospitals and all the community health centers electronically in the state of New Hampshire. Now I know Commissioner Toompas doesn't have the resources to put that in place now, but when the Secretary says shall, he will have to. So if someone says that there are no additional costs for Medicaid until 2015, I can assure you that is simply untrue. The next provision in the bill that would impact the state budget is the Medicaid expansion. That's going to cover individuals, able-bodied, childless adults, up to 150% of the federal poverty level. This would be the first time in the state's history that the state would be covering able-bodied childless adults and represents the greatest effort to create a categorical universal healthcare system in our country. Now, according to the legislation, these costs are going to be covered entirely by the federal government until 2014 in the House version, at which point the state would then begin picking up 9% of the cost. However, as we learned a long time ago with special education, funding promises from the federal government often do not translate into guarantees. Since one Congress cannot enforce what future Congresses are going to do, I suspect that the funding pressures in Washington will see that the federal government is going to reduce that amount. I predict the Medicaid expansion here will become the next special education scenario for the state of New Hampshire. And 10 years from now, we're going to be talking about how the federal government is not living up to its obligations all over again. Now, this provision regarding the 150% of the federal poverty level also has a Senate component that requires states to pick up 50% when that 2014 kicks in. Nobody knows exactly what that percentage is going to be in the end. The bottom line is it's devastating. In my projections that you'll see in the $1.2 billion, I took averages. I took that 9%. 2015, if you add 9%, in 2015 the impact becomes $15 million alone. And it grows at a 7.9% expected Medicaid growth for the next 10 years. It grows to the $30–40 million range outside. That's only at 9%. And I will guarantee you it will never stay at 9%. The other provision that directly impacts our budget in this bill is what we refer to as the disproportionate share hospital revenue. There are many representatives and senators and individuals that have fought for the DISH program over the years in New Hampshire. We know that program has been in existence for a number of years, beginning in Senator Gregg's term of governorship all the way through today. And that program helps us to account for the charity care in this state. There will be two effects. First, there will be a shift in this funding formula that states with higher uncompensated care, which means more money for New York and Illinois and some of these other states, California, that have less money for New Hampshire. What that means is that the disproportionate share methodology that changes in year 2017, when at that point the amount in our budget will be expected to be $157 million a year, New Hampshire will no longer be able to have those funds come into this state at a tune of $157 million starting in 2017, and again, projected at 7.9% per year. Pretty significant increases in impacts to our budget. The other portion of the disproportionate share change, the federal government, and I know as commissioner, has been trying to change this program and impact New Hampshire's budget for years. And now Congress is going to allow the Secretary in 2017 to change dramatically the methodology in the DISH program. It will no longer be the program we know today. This will eliminate the state's Medicaid enhancement revenue. Now, whatever one might think of the Medicaid enhancement system, the fact remains that losing these funds creates an enormous hole in our state budget. Finally, one last provision is near and dear to my heart as a former commissioner, and that's the provision that will prohibit states for the next 10 years from doing anything to change eligibility or benefits. And this means that the program that already is the largest state government program in our budget cannot effectively be managed by the department commissioner and his staff or her staff. That is wrong. And that's a provision that's in both the House and the Senate versions. This means that as Medicaid continues to grow, it'll mean higher and higher taxes, as well as cuts in other state programs. You're going to squeeze these other programs in the state budget, and there will be impacts to these other important safety programs. So it's time to step up, defend the taxpayers of this state, and stop a plan that will lead us down the road of a state sales or income tax.